So I wanted to talk a little bit about my journey on throughout my diagnosis of POTS and Gittleman's. I surely just hope you're watching this video because it's something that you're interested in, POTS or Gittleman's, or and you just wanted to hear how my story, how my story was, and if it is anything that can help you. Because if you're looking for this video for entertainment, it's not entertainment by any means. It's just more of an informational video to try to help people. But I'm going to make it as short as possible because it's a lot of information at once, and the reason why I'm sharing it is that I'm hoping that there's other people out there who can relate or are going through something similar, or maybe are trying to find a way to get to a diagnosis, and maybe my journey can maybe help guide them if that's what it does. So hopefully. So back when I was in middle school, I started having kind of weird feelings, like my heart was racing really fast. It was kind of hard to breathe, and things were looking a little weird, and everything was looking a little strange, and I was thinking, to myself, I think I'm going crazy. And I remember telling my mom, and she took me to the doctor just to make sure everything was okay. I saw a doctor multiple times. No, everything's fine. I think you've got anxiety. So they sent me to a counselor. And so I went to counseling, and it was helpful. But then they eventually was like, they're still not covering everything. So we ended up adding medication. So I went through a ton of different medications from middle school to even like through college and after college, where they kind of threw out this, here's an anxiety med, and I would take it. It just wouldn't really help, maybe help a teensy bit, but it just wouldn't really do everything. And I know that meds aren't supposed to be fixing everything, but I would do it in a combination with counseling, and things just weren't still feeling right. It was a little hard to explain, but it just didn't seem right. I had to kind of deal with it, because every time I would go to the doctor, I'd be like, no, I really think something's different here. This is what's going on. They say it's just anxiety. You just need to get over it and accept it and move on. But I just wasn't taking no for an answer. And it wasn't like I was a hypochondriac trying to, I know there's always something wrong. It's not always something wrong. I knew that I felt something different in my body, that it just didn't seem right to me. And I just kind of decided I had to be my own advocate. And there was a lot of times where a lot of doctors would just constantly look at me. You just need to stop thinking you've got something and just kind of move on with your life and just deal with it. And I was really frustrated because I felt very defeated, and I'm sure a lot of people who've had the same situation kind of feel the same way. So I started having some heart issues where I was at work one day, and all of a sudden I was just on the computer typing, and all of a sudden my heart was going really, really fast in like an irregular beat, like it just wasn't a normal beat. I mean, there's a fast heart rate, and then there's like an irregular heart rate, and mine was a faster regular. It was like a combination of both. And so I ran over to the oral surgery department where I work, because I work at a dental school. And the oral surgeon looked at me, and she's like, "Yeah, this isn't right. We should have you get checked." And so we called 911. I work, we're on the hill next to a hospital, but the ambulance came like a block and picked me up, and then hooked me up with all these things, all these electrodes and everything. And then we went up to the hospital. I mean, it was the shortest drive of my life and the most expensive drive of my life, even though I had insurance. So anyway, while I was in the ambulance, I had all the electrodes on, and they were saying, "Yeah, you're throwing a bunch of PVCs and PACs." And at the time, it was just all over my head, and they're like, "You're really tachycardic," and I didn't know what the heck, and I was freaking out. Oh my God, does this mean I'm gonna die? Like, what's going on? This is something that's, I've had these issues before, but not to this extent, because this time, it wasn't going away. It was, these beats were going for at least like a 2 to 3 hour period where it was just an irregular beat, and it just was really bothering me. It started kind of hurting my chest and kind of going up my neck. Anyway, so going to the hospital in the emergency room, they took some blood, and they kind of said the same things. Yeah, you're throwing out these PVCs, these PACs, and they kind of explained them to me. They're premature ventricular contractions and premature atrial contractions. It's kind of like where if your heart, where you've got your heart, and there's a part that beats, like a node that beats and a node that beats. And so normally those things would do bump, 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 bump. But instead, it's different parts of your heart decide to fire instead. So there's all this electrical stuff. So instead of this part, it's like this part, bump, 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 bump. And so it just kind of, it's a really bad way to explain it, but that's the best way that I can explain it, is just other parts are deciding to beat besides this main part. And so it really kind of throws it off. But they kept on saying, no, yeah, it is something, stop drinking caffeine and do these, maybe change these things, but you're not gonna die. Okay, so kind of got that. Okay, well, it's good. And, went to the cardiologist as well because they had to send me to that just to make sure. And they said, yeah, you definitely have these things, but you're not going to die. But it is super annoying and it's hard to, you just got to learn to live with it. I could have had a surgery, but I decided not to because there wasn't a 100% chance that it would actually fix it. So kind of fast forward. At that point I was like, okay, so I know I've got these things. It's not life-threatening. I'm just gonna live with it. So fast forward a little bit and I started getting the same situation, but it would last even longer and it was a little bit more different. And I remember calling the cardiologist and saying, this is what's going on in the middle of the night, because I remember waking up and I remember I had my like a heart monitor watch on, and I would wake up in the middle of the night and it was 187 beats a minute or something, and it would freak me out. And so I'd call the cardiologist and they'd say, okay, do these different maneuvers to help you bring your heart rate down. And one of the ones that worked for me was this thing called vasovagal. There's a lot of different ways that you could do it, but the one that worked for me is kind of just bearing down for a long period of time, and it kind of rewires. It has to do with your vagus nerve, and it kind of just rewires it for you to kind of set things back, and it did help a little. But I remember one day it wasn't working. It doesn't matter how many times that I did that maneuver, it still wasn't working. So I went to the emergency room. Again, that was the local one in the area, and the doctor there was super nice, and he's like, I was looking over your charts, and every time that you come in, even when you're on the ambulance, other places and stuff, you've always constantly had low potassium. And I think that's actually, and it's not just not a little bit, it's a lot of low potassium, and it's not, so I think you should go see a nephrologist. So I was referred to a nephrologist and had an appointment. She was awesome. I had a ton of different random tests where I had to like pee in this huge gallon jug for 24 hours. It was weird. This is seriously the weirdest thing ever. It's like trying to live life and yet bring this jug, because I couldn't just stay at home for 24 hours because I have a son and I have a job, and I didn't have time for that. So I had to like hide this pee jug with me. It was super awkward. Anyway, they did some lab tests as well. Come to find out that I have this really rare disease called Gittleman's disease. It's very rare, but Gittleman's is a kidney disorder, and the only way that I can explain it, because it is a little confusing, it's pretty much like your body pees out all of your electrolytes. So instead of keeping them inside, so with your kidney, there's a little valve in there that'll say, hey, we've got all the salt and magnesium and potassium. Should we keep it because the body needs it, or should we just flush it out because we don't need any more of it? Well, that little valve is missing. I was born without it, and you can actually get genetic testing to see if that's something that you actually have this disorder. So my valve has completely never been there, and so I'm constantly wasting those electrolytes. And if you think about it, when you are low on electrolytes, so like if you kind of get dehydrated kind of feelings where you get lightheaded and it feels like you're gonna pass out, and weird, it kind of seems kind of similar to anxiety symptoms. And so things kind of started making sense. It's like, okay, I've obviously dealt with this Gittleman's for my whole life. Didn't know it until, probably started, maybe showing its face, when I was middle school, or when I started having these issues. And now I know what it is, and I'm very lucky that I never had any huge crashes, because the scary thing with Gittleman's is you can get to where your potassium and your electrolytes are very, very low, and you can have, you could eventually, it's scary, but you could die. You could have a heart attack, because potassium, magnesium, all those elements, vitamins, deal with the electrical system in your heart and your body. So if your potassium is super low, it's gonna misfire your heart. Things aren't gonna be beating the right way, and so it could cause an arrhythmia, and it could even cause a deadly one. So it's a very serious condition that needs to be constantly monitored. Kind of like someone that's diabetic, they need to make sure that their levels, their sugar levels okay. I constantly have to check my potassium, magnesium, sodium, calcium, all those levels to make sure that they're okay. So I ended up having to try different medications. The first medication that my nephrologist tried was one that was like this potassium sparing diuretic, and didn't work for me because my blood pressure is quite low. And when I say quite low, I mean, when I go to the doctor's office, they tend to get a little freaked out because I'll be sitting there just talking regular, and they'll take my blood pressure and they'll, you feeling okay? Yeah, why? Well, your blood pressure is 90/50, you know, and that's my normal. It's super normal for me. I've always been that way, and my mom's been this way. I don't know if it's like a genetic thing, but I've had very, very low blood pressure. But that's also why I get very lightheaded and dizzy, and kind of, it does affect the way that life goes for me sometimes. So it's something that I deal with. So the medications that ended up working for me, that I'm on constantly now, are, I have to just take a ton of potassium pills and sodium and calcium just daily. I just have to take it. They're like, my potassium pills are like horse pills. And who really needs to normally take salt? Normally, in most people, they tell you, oh, cut your salt out. Mine's completely opposite. They tell me to add as much salt as possible. I am, and the wonderful thing about taking salt is it gives you this nice plump look, which is fantastic. Don't be jealous. Another thing I do though is I take medication, Midodrine, that raises my blood pressure. So it's nice because it'll actually raise it to a kind of normal. It's still low, but it does kind of even it out for me. So maybe a blood pressure when I go to the doctor when I'm on Midodrine, maybe about 105/60, you know, which is like whoop whoop, it's pretty good. So that does help. That's with medication. There's a lot of downsides to taking all these random medications, and my medicine bag is huge, and it looks like I'm a 90-year-old person, and I think I take more medications than a 90-year-old person. Anyways, just to maintain. So getting the Gittelman's was an awesome diagnosis for me because it made a lot of sense, and I felt so much better having an answer to actually why things are going. I knew that I did have some type of a little bit of anxiety, but it was not, but then I found out that it wasn't to the extent that they thought it was. With everybody's got anxiety. I get anxious about certain situations, and that's normal. But coming to find out that it's a lot of it had to do kind of with this Gittelman's. Now with Gittelman's, I developed this kind of secondary kind of syndrome. It's called POTS, and POTS, P-O-T-S, POTS, stands for Positional Orthostatic Tachycardia Syndrome. Well, obviously Gittelman's was first, but I think POTS kind of developed also as well. And it's where kind of when you stand up, your blood pressure, for me, since I have these blood pressure issues, and you stand up and you kind of get that kind of fun feeling, and then you pass out sometimes because it's not getting the blood to your brain. So part of the reason is you know, when you're standing up in your legs, your veins and your vessels and everything, they compensate when you stand, so it pushes the blood up to your, kind of up, so it comes up to your brain and you can actually feel normal. Well, with POTS patients, a lot of them is those vessels, those things don't work very well. And so it does not push that blood up to the brain. And so when you do stand up, that tachycardic part of it is just trying to, it's kind of like your body's trying to rev up. It's like, okay, what's going on? I just need to get some more blood to the brain, work things out. The way that I got diagnosed with POTS is that my nephrologist had said something like, well, you know, because I was telling her about these standing up, sitting down things, super weird. So they gave me a tilt table test, and it's where they strap you to a table, and it's a little weird. And you're laying down, and they take your blood pressure, and then over a period of time, they start kind of raising you up, and they're monitoring you the whole time. Eventually, you get to this almost standing position, you know, and they just watch you and see how your blood pressure is and how your body reacts. For me, it was things were feeling okay, and then all of a sudden it was just, you know, not good. So I had I don't know if you would say a positive or a negative test, but because of the test, I got diagnosed with POTS on top of it. So I started seeing a neurologist. So the two doctors that I see, are the nephrologist for the kidney disorder and the neurologist for the POTS disorder, because POTS is an autonomic disorder. So a dysautonomia is what they call themselves, what they call it. It's kind of under the umbrella of different types of dysautonomic disorders, and POTS is a kind, and then there's a bunch of different other kinds. I think there's, I don't know, maybe up to 12 or so. So with POTS, there's a big difference between a lot of different people with POTS. There are some people who have POTS and they're completely laid up in bed. They cannot really function very well at all. That's my dog barking in the back. He's super annoying, but I love him. Anyway, so you have these two different sides. You have people that are 100% bedridden, and then you have people like me who can work full time and have, and live pretty normal lives. And in between, there's people that are in wheelchairs. It's POTS is this insane syndrome that encompasses so many different things, and you gotta look up stuff, look it up, see all the different parts of POTS, because I can't explain it and give it any justice. But I'm very lucky that I have that I am on the side that's not bedridden or in a wheelchair or anything like that. So thank the Lord for that. I'm very, 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 very fortunate about that, because I know a lot of you out there are in wheelchairs and are fully disabled, because I think it said 30% of people with POTS are disabled and can't work, and it may be even higher. And I can see why, because it is frustrating, and it can be very debilitating, especially if you have a flare-up. So with POTS, with people with POTS, if you get sick, it is a lot harder for us to bounce back from being sick than it would be for someone who doesn't have POTS. It just takes your body a little bit longer to bounce back, and so you have to know your body. You start getting to know your body and your limitations, and energy-wise, energy's an issue that I deal with all the time. I'm constantly tired, and it's been a hard time, it's been a really long journey, but I'm super happy that I've gone this far and that I was my own advocate and had to push, because getting pushback was really hard, growing up and kind of having family look at you like, really, you've been to doctors so many times. What else do you think is wrong with you? And getting labeled as a hypochondriac, and that was very frustrating, because after a while you start thinking, maybe I am. Maybe there's, why can't I just accept that there's nothing wrong and be okay with it? But I knew that there was definitely something wrong, and I'm not a hypochondriac, because there were lots of things that I'm like, don't have, don't have that. And I probably sometimes should be a little bit more worried about things or what's wrong, but no, and so it was hard to deal with the backlash of dealing with trying to figure out what is wrong, because it's kind of like, okay, hey, what's new with you? What do you think you got today? But let me tell you, once I did get a diagnosis with Gittleman's and POTS, I no longer go and be like, I feel like something's wrong. I don't have that thought. There's nothing that is out of place that doesn't feel right. I have full faith that this is what's going on, and it actually has kind of freed my mind and time and space, and it's been fantastic knowing what it is and just moving on. So I hope for people who are struggling out there that have not who are kind of we're in the same boat with me, where, you're getting these answers, but, things aren't right, and that you're not a hypochondriac, but you be your own advocate and you keep on pushing. After the doctors had given me the diagnosis, every single doctor after that, oh yeah, that makes sense. So the thing to remember is doctors work for us. We pay them to work, and they're just practicing. And I'm not saying anything bad about doctors. I really don't want to. I think that they're doing the best that they can with what they've got and what they know. POTS is kind of becoming this new thing, and so there's not a lot of doctors that know much about it. There's not really people that specialize in it. I am lucky that I have a neurologist that specializes in it, that has patients come from all over Oregon, Washington, Idaho, California, just to come see her, or even further. So I'm really lucky that where I am is I do have a good resource for that type of thing. Gittleman's is super rare. Don't assume that you got it. It's very, very rare. That even my nephrologist, she's been practicing for over 20 something years, and I'm her third patient who's she's ever had with Gittleman's. So don't freak out and think that you've got this random Gittleman's. But POTS is more common. I think it's a lot more common than than they think. And I think that POTS can get really misdiagnosed a lot with anxiety. So it's worth it to go ahead and check it out and do some research on it. Maybe, Google, but don't Google like so much of the stuff. If you are the kind of people that if you go, you look on Google and like, I have a scratch, and then, oh my gosh, you find out you've got cancer, and you're gonna die. Don't look up stuff, But if you do look up stuff, go to those reputable sites, the PubMeds, those type of sites. Don't put your faith and don't trust people that do these videos to diagnose you with your particular thing. Go out and look up information, see what kind of information that may apply to you. And just kind of look at it as maybe an option. It may not be. You may just have anxiety and it's really bad, and you've got to find the right combination of medications. And that's okay, because, even through all this, I still have anxiety issues. But one day I was driving home from work, and I was kind of in a zone, and I felt like, I feel like I'm going to pass out. And so I looked down at my watch, and I was like, what's my pulse? And I looked at my watch, and I checked my pulse, and it was at 40 beats a minute. And I was just so exhausted. But then I was like, oh, that's kind of weird, And then I started thinking like, oh, I need to start getting my blood pumping. I don't want to pass out, while I'm driving on the road. And so I kind of instantly felt this not panic, but my body started kind of kicking in and being like, ooh, okay, let's get the blood pumping. Let's get this stuff moving. Start flexing your arms, start getting things moving. And it's interesting because I think that's kind of how a lot of my anxiety was. I think it was from a symptom from POTS or from Gittleman's, having these, really low heart rates, because that's one of the things, and because it does have high heart rates, but mine also has low heart rates. They found that on a heart monitor that I wore. And so my body compensated and brought on an anxiety type symptom to compensate for that low blood pressure and that low heart rate. So give your body credit. It does do things in mysterious ways. It's way smarter than we think it is. But that's kind of how, one of the things that I realized, that this is not anxious. I am not anxious about this. And kind of like looking back also, is, when I would go to the doctor and I'd say, I've got all these weird things they're going on, and they'd say it's anxiety. So I'm not anxious. I'm not anxious. You can tell that my blood pressure is super low. You can tell that my heart rate it's a little elevated, and it's actually maybe a creepy, high level. But I'm not anxious about it. So I hope if there's any doctors watching this at all, that you do maybe just start thinking a little bit differently in the fact that, these patients out there, anxiety may just be what it's kind of manifesting as, and it could be an underlying problem that it actually has, and it's kind of manifesting as anxiety. So I hope that helps. Be your own advocate, and don't take no for an answer. If you feel like something's wrong, and you have definitive evidence that there is something that's just not right, just dig a little bit deeper, and push harder, and you'll get the answers. It just may take a bit.